Hello and welcome to Pregnancy Info. Today we are going to discuss what is pelvic pain in pregnancy. Some women may develop pelvic pain in pregnancy. This is sometimes called pregnancy-related pelvic girdle pain or PGP or symphysis pubic disinfection or SPD. PGP is a collection of uncomfortable symptoms caused by a stiffness of your pelvic joints or the joints moving unevenly at either the back or front of your pelvis. Here are some symptoms of PGP. PGP is not harmful to you and your baby, but it can be painful and make it hard to get around. Women with PGP will feel pain over the pubic bone at the front, in the center, roughly level with your hip, across one or both sides of your lower back, in the area between your vagina and anus or perineum, spreading to your thighs. Some women may feel or hear a clicking or grinding in the pelvic area. The pain can be worse when you are walking, going up or down stairs, standing on one leg, for example when you are getting dressed, turning over the bed, moving your legs apart, for example when you get out of a car. Most women with PGP can have a vaginal birth. The question is when to call a doctor. It's hard for you to move around. It's hard to get out of a car or turn over in bed. It's painful going up or downstairs. These can be signs of pregnancy-related pelvic girdle pains when you need a doctor. Treatment for PGP. Getting diagnosed as early as possible can help keep pain to a minimum and avoid long-term discomfort. You can ask your midwife for a referral to a physiotherapist who specializes in obstetric pelvic joint problems. Physiotherapy aims to relieve or ease pain, improve muscle functions, and improve your pelvic joint position and stability. This may include manual therapy to make sure the joints of your pelvis, hips, and spine move normally. Exercises to strengthen your pelvic floor, stomach, back, and hip muscles. Exercises in water. Advice and suggestions including positions for labor and birth, looking after your baby, and positions for sex. Pain relief such as TENS. Equipments if necessary such as cruciates or pelvic support belts. These problems tend not to get completely better until the baby is born, but treatment from an experienced practitioners can improve the symptoms during pregnancy. Now here are some tips for coping with pelvic pain in pregnancy. Your physiotherapist may recommend a pelvic support belt to help ease your pain or cruciates to help you get out. It can help to plan your day so you avoid activities that cause you pain. For example, don't go up or down stairs more often than you have to. Be as active as possible within your pain limits and avoid activities that make the pain worse. Rest when you can, because rest is best. Ask your family, friends, or partners if you have one to help with everyday activities. Wear flat, sportive shoes or comfortable shoes. Sit down to get dressed. For example, don't stand on one leg when pulling or putting on jeans. Keep your knees together when getting in and out of a car. A plastic bag on the seat can help you swivel. Sleep in a comfortable position, for example on your side with a pillow between your legs. Try different ways of turning over in bed, for example turning over with your knees together and squeezing your buttocks. Take the stairs one at a time or go upstairs backward or on your bottom. If you are using cruciates, have a small backpack to carry things in. If you want to have sex, consider different positions such as kneeling on all fours. Here are some things that you must avoid if you are feeling or you are suffering from pelvic pain. Standing on one leg, bending and twisting to lift or carry a baby on one hip, crossing your legs, sitting on the floor or sitting twisted, sitting or standing for long periods, lifting heavy weights such as shopping bags, wet washes, or a toddler, vacuuming, pushing heavy objects such as a supermarket trolley, carrying anything in one hand. Try using a small backpack. The physiotherapist should be able to provide advice on coping with the emotional impact of living with chronic pain, such as using relaxing techniques. If your pain is causing you considerable distress, then you should let your GP or midwife know. Birth with pelvic pain. Many women with pelvic pain in pregnancy can have a normal vaginal birth. Plan ahead and talk about your birth plan with your birth partner and midwife. Now, the question is that who gets pelvic pain in pregnancy? It is estimated that PGP affects up to 1 in 5 pregnant women to some degree. It's not exactly why pelvic pain affects some women, but it is thought to be linked to a number of issues including previous damages to the pelvis, pelvic joints moving unevenly, and the weight or position of the baby. Factors that make a woman more likely to develop PGP include a history of lower back or pelvic girdle pain, previous injury to the pelvis, having PGP in a previous pregnancy, a physically demanding job, being overweight, having a multiple birth pregnancy. Other than that, you must know a thing. That is, what is pressure or pain? Pressure versus pain. While pressure in the vaginal or pelvic area is one thing, outright pain is quite another. Pressure in the area can feel similar to the ache you experience with menstrual cramp. You might also notice aching in your low back. Pain in your pelvic region is hard to mistake for pressure. When you are experiencing pain in this area, it's usually sharp enough that you will have a hard time walking or even talking through it. In that case, you should contact your doctor right away. So, this is all about the pain in your pelvic area during pregnancy. I hope I have explained all the symptoms, signs, treatments, and all about it. If you find this video useful, then must share it with your friends and family members, especially with the women who are suffering with this pelvic area pain and wishing to have advice for that. And also subscribe our channel, and you can comment in comment section for more videos you want to make. Thank you.